Right, so one of the things we need to look at is how do we integrate all these different things that we know how to do into a structured and complete session. And not only what we've learned in crystal surgery, but all the things that we've learned elsewhere. We don't want to throw those away just because we want to do energy healing or crystal surgery. We want to learn how to integrate everything. So what I thought I'd do is demonstrate how I fit it together for myself between all the different bits and pieces that I know about. And of course, my number one thing is the Alexander technique. So we're going to begin there with the Alexander technique. Okay, and I'm going to explain what it is that I'm doing and what I'm looking for, because I'm not doing this in order to give you an Alexander lesson, which is also a very beneficial thing to do, but I'm using the Alexander technique as a platform for my energy healing and crystal surgery work. And so I'm using it in a very specific way. But while I'm about it, I also do want to give you quality Alexander input, because I may as well, and because Alexander technique is a neuromuscular training, and I may as well do that while I'm about it, except I won't be addressing too much of it in terms of your consciousness. I'll just be using it to open up the alignment and open up the energy in your system so that we can get the healing in as well.
Okay.
All right. So we're going to have neuromuscular training at a subliminal level, and we're going to have crystal healing and crystal surgery as well, and maybe a few other things thrown in as we go along. So we know that you have a sore knee, and we're definitely going to be looking at that. And then we'll also be looking at other things that are going on. Right now, what I'm going to do is just check your alignment. And it's pretty good, except I can tell you've got some neck tension. Oh, that's okay. I'll do it, you see. That's right. And pretty much the Alexander technique can be watching paint dry or watching the grass grow. But we'll see what we get going here. And I'm just feeling to see whether the energy can flow from the top of your head to the soles of your feet, and from the soles of your feet up to the top of your head without too much interference. And the areas of interference that I'm sensing are here in the shoulder area. Don't do anything, nothing to worry about. A little bit of tightening through the middle of you over here, and then your legs. You don't have that much sensation in your legs as I would like you to have. So I'll just be monitoring that. You sit, knees bend, hips bend. That's right. Good. Good. And finding the chair. And then I check what happened on the way. And there's that neck tension. And that's it. Can you see? You can feel that lifting, can't you?
Yeah, I'm getting taller.
Yeah, and that's because we're getting the muscles to release their overcontraction and get you a little bit lengthened. But don't do it. Don't be anxious. Let me do it. Nice. That's great. That's right. And what you want to do is trust the seat. Trust the chair to support you. And so I can tell from the way that you're sitting in the chair that you've got something going on where you feel something's a little bit out of control in your life. Is there something like that going on?
Yeah.
Is it stress at home?
It's a lot of stress at home.
Oh, okay. So maybe we should look at that also in the session.
That would be helpful.
Okay. All right. And I'm also sensing, let's check this over here. It's as if you're worried about what's coming up behind you, like what you can't see. There's an out of control feeling. Yeah, yes. Yeah. That I can sense that feeling in your musculature where you're on guard, is how I can put it. I can feel that on guard feeling. And that's why I'm doing my Alexander technique to begin with. So I can get this kind of read. You know, the body doesn't lie. It's as simple as that. So it's more accurate for me to get the read from your body than it is to ask you, which I know is strange. But people don't really know what's going on with them, and they hide stuff, you know, from themselves. There's self-deceit going on. But they also don't want to admit to stuff. So I can get a more accurate reading if I just go ahead and do it for myself like this. So, and also I can sense the priorities, you see. You might report one thing to me, but then I can pick up on something else by doing this. And even us just talking about it, you've released quite a lot already. So that acceptance, that acknowledgement is helping. Now, what I can't feel is your feet. Don't do anything. But know where your feet are. Take a moment and think, where are my feet? That's better. And then trust your feet for standing. Beautiful. So that's a little bit tense in the shoulders again, and your arms kind of flew out a little bit from your sides. So we just let the inside of your arm hang close to the body. That's good. Just soften at the knees ever so slightly. And if you put your feet a touch wider apart, that will help also. It does give it nice to have a slightly wider base to stand on. Yeah, without muscle tension. We don't like over-engagement of the musculature in the Alexander technique. We're trying to go in the other direction. That's nice. Good. Oh, Linda, that's very nice. Now, you see that sway?
Yeah.
That's correct. And you see you got the breathing change. You even started blowing the breath. That's you releasing a bucket load of tension. And that's what I want before you go on the table, because the quality, now that you've done that little bit of realignment and releasing, will be hugely improved. So next up is table work, and that's what we're going to do next.
Okay.
Great. Right, so we're going to do some Alexander table work now, and you're familiar with that. You've done it before, but I'm going to explain a little bit about what's going on as I'm setting it up, because I don't usually do that, do I? Today's the day, a special day. Okay, so I'm going to ask you to lie with your head over here, and your feet are going to swing there, and if you just swivel around and place yourself on the table. Good. Fantastic. So most people, when they lie down, they don't lie down straight, and it's quite important to get the alignment improved, and so we will look at that. And we'll organize your stones. Lovely chevron amethyst. That's very nice. That goes so well with your top too. I love that harmonious color effect. That's nice, right? So let's put your hands here. Good. All right, and before we get too deep into this, I know about your knee. We've been talking about that for a while, and I'm going to do anti-inflammatory for acute for this. Is there anything else going on physically?
My hands are sore. I've been having muscle spasms.
Oh, really?
Like massage,
like,
yeah.
Oh.
Just cramping up.
Do you think it's the fascia being tight?
Mm-hmm.
Yeah.
I think that's part of it for sure, yes.
Part of it, yeah. Okay, so your hands. And we did pick up a little bit on neck tension. Right. And then there was the stress at home.
Yes.
And would you say that that stress at home tends more towards depression or anxiety?
I don't know if it goes with, but I think it's both.
It feels like both?
Yes.
I know, it's actually very hard to distinguish between the two. So, I tell you what, is there like an anger component involved? Is there grumpiness? And
yes, there's
okay, then let's go with the antidepressant procedure.
Okay.
Because the antidepressant procedure has got the built-in dealing with the anger and resolving the anger, because anger is one of the sort of pathways by which we become depressed. Suppressing anger or not being able to express ourselves, feeling frustrated, it kind of bottles up and leads to depression. So let's assume that because there is the angry note. And we can't really go wrong, because the anti-anxiety and antidepressant procedures are fairly overlapping. And one of the differences is the anger note. So definitely we'll go with that. All right, so we'll go through this systematically, but let's begin with the Alexander technique. And I like to get the feet placed like this. And we use this little mat here because otherwise your socks slip on the fabric and then you have to grip up in the muscles. And this particular position is called Semi-Supine because you're lying down. That's the supine part, and the semi part is that your knees are raised and your feet are flat on the table. And this is helpful for your lower back. If you were to put your legs out straight, your lower back would arch here. And this is someone you can just test out, but don't do it now. And in fact, your back is arched. It's and you're twisted. Like over here, I can get my hand in. I can probably get it in, like right there. I'm touching my hand and I'm just getting it in a little bit. And that's the arch in your back, and that's not how we want to be. And this is the strange thing about us. We're so tense we can't even lie down properly. It's so bizarre. We're so messed up. And we're all like that. Even the people who look good, their posture may look good, but I'm telling you, we're all carrying way too much tension. There we go. That's it. Doesn't that feel fabulous?
That really does.
And as I say, unfortunately, it doesn't look like that much. It's like watching paint dry, but honestly, for me, nothing feels like the Alexander technique. It's so, see there already, I can't get my hand in past your spine. Mm-hmm. But there's more, you see, because we can come this way and just lift up ever so slightly. That's it. Let me do it and lengthen you out and then back down again. Lovely.
Nice.
Yeah, it's a relief, isn't it?
Mm-hmm.
Very good. Excellent. Oh, excellent. Actually, I want to turf you off the table and get on myself. My turn.
Yes.
All right. Okay. Right. That's it. And so everything that I'm doing now is technically Alexander technique, but see, I learned about energy, and I learned about energy healing by teaching the Alexander technique to so many people. I was giving 15 appointments per day. These were half-hour appointments. And I really got an immediate training in the human energy field and how energy moves through the human body, because I was just doing this in such sheer quantity, this Alexander technique. And then I became telepathic and all kinds of weird stuff too. It just happened on its own from the sheer amount. So very important in the Alexander technique is the head-neck-back relationship. Let's make sure this is in good order. That's it. You see how nicely the head is reorganizing on the top of the neck, and you see there's the muscles lengthening through your back. I bet that feels good. Wonderful. And again, unfortunately, watching paint dry is the name of the game, but you can see the breathing changes every now and again, and that's in response to the release of tension. There we go. And see, this is very ideal, Linda. Your hands are nicely relaxed. You know, people do very strange things. They interlace their fingers, they press their thumbs together like this, and they do all kinds of things. But your hands are beautifully relaxed, and you're letting go here, and that's the best thing you could do. You need to do that because as you said, you're using your hands and your forearms a lot with the massage work, and the fascia is getting a little bit tight. That's right. That's it. Unwinding all the way into your neck. I bet you could feel it all the way here. Very, very good. Okay. So now what I want to do is put my hand under your sacrum. So if you could lift up here, and I put my hand under the sacrum like that, and you will feel, and I'll tell you when I think you can feel it already actually, the pulse of your sacral pulse against my hand. So people think I am doing something. Hand. I know. They think I'm doing something with my hand, but it's your sacral pulse pulsing against my hand. I'm not. My hand is completely quiet. It's just like my top hand that you can see on the top of your body. That's how quiet my hand is underneath at the sacrum, and there's the pulse. That's it. That's it. And I'm getting the breathing release, and I like it. That's it. There you go. And there's a little reorganization of the tissue. That's lovely. That's what we want. Now don't help me when I slide my hand out. It will lengthen your back, and it will feel like there's a hole in the table. Yes. Yeah, it's the famous hole in the table that doesn't exist. Lovely. All right. Now we do the legs. So what I'm doing is just getting the tension, the habitual tension in your body to release, so that I can get the energy flow to be as easy and strong as possible. If we have tense muscles and if our joints are compressing, every joint is a chakra. And so if our muscles are tight, they pull on the joints and they compress the joints. And then the flow, the energetic flow through our body cannot possibly be as good as if we release that muscle tension and allow a flow. And it's a psychophysical flow. But if you line up the mental and the physical, then you've got a good chance of lining up the energetic as well. And if the mental and the physical are not that well aligned, you've got an uphill battle to get the energetics aligned. So if someone's in a chaotic state and they're very, very tense, you have to do something to get them to relax first. You can't just run in there and sort of force energy to move around in their system. And that's what we're doing here. We're getting you prepped for an excellent energetic input. Nice. And I do like to check how the knees are. That's it. Lovely. You see how you can feel your brainwaves shifting. You're getting more and more relaxed.
Mm-hmm.
Good. Side. Good. What's important in the Alexander technique is to work with the bones and to get the tissue to soften and release and stop pulling on the bones. That's right. Isn't that delicious?
It is. It's
You actually feel your leg
so
lengthening.
subtle, but so good.
Yeah, because you want to get those contracted muscles to release and lengthen and not to pull. Your muscles should behave as a perfectly fitting suit that allows you to move. We're always pulling ourselves about with our muscles, but actually, if we can learn to allow movement instead of force movement, we do way better. That's lovely. That's excellent. Oh, good. Nice. Top to toe. Isn't that delish?
Mm-hmm. Yes.
I love it. I just love it. That moment when you just feel the muscles go, whew, and they release and lengthen. It's so delicious. Never gets old. That's it. And then, of course, this checking the bottoms of the feet and the tension in the feet. People carry so much. Have you noticed that in your massage work?
Absolutely.
Wow, it's really something. I used to have some clients back in South Africa. They didn't relax until I touched their feet and got their feet to relax. That's it. Nice. There we go. So that is the first part of the Alexander piece. We always go back up to the head, neck, back relationship. Good. Your hair was caught on something here. Let's see. There we go. Just check that. And then what we'll do is get you set up on the bolster. Let's go get that. And so now, Linda, if you'll just take your knees towards your chest, and I'll put the bolster here and get you organized on the bolster. I think lift up again. The bolster's a bit low. There we go. One of the things you don't want to do is move the bolster around while the person's resting on it, because then they have to stiffen and tighten their body while you're pushing and pulling the bolster.
Good to know.
Yeah. Yeah, I'll show you. Just see how this feels. I'll do it gently so it doesn't, disrupt things. See how that has to register in your body if I tug on the bolster and move it around. And I don't want to undo what I've done. So there we are. You know what? I think your iliopsoas muscles are a little bit tight as well. So I'll pay attention to that in due course. All right?
Okay.
Excellent. I think we can move on to the crystal part of what we're doing. Wonderful.